Hello and welcome to Health 247 on Rapid TV, the program that brings you trusted health insights, expert advice, and inspiring stories. In this edition, we take a closer look at the ongoing efforts to strengthen cancer prevention and awareness in Nigeria. I am Josephine Bitrus. Thank you for staying with us. Cancer is a broad medical condition covering over 100 different types, each with a significant impact on global health. Understanding cancer statistics, both in Nigeria and around the world, is essential for shaping effective policies and measuring progress. According to World Health Organization (WHO), cancer is the second leading cause of death globally, accounting for 1 in every 6 deaths. The WHO also reports that about 70% of cancer-related deaths occur in low and middle-income countries, including Nigeria. These figures underscore the urgent need for stronger awareness, prevention, and treatment strategies, particularly in countries like ours. Today on Health 247, we focus on the efforts of the National Institute for Cancer Research and Treatment, NICRAT, to improve cancer prevention and awareness nationwide. Cancer is a group of diseases where normal cells transform into abnormal cells that multiply and spread uncontrollably. Normally, genes send instructions to cells telling them when to grow, divide, and stop growing. But in cancer, cells ignore these instructions, growing and spreading without control. According to the World Health Organization (WHO), cancer is the second leading cause of death globally, responsible for 1 in every 6 deaths. The World Health Organization also states that approximately 70% of cancer-related deaths occur in low and middle-income countries, including Nigeria. There are over 100 types of cancer, and healthcare providers categorize them based on their origin in the body and the type of tissue they affect. Common cancers include breast, prostate, cervical, and colorectal cancers. However, challenges persist, such as late presentation for diagnosis, limited access to screening and treatment facilities, and high out-of-pocket expenses for patients. Cancer is a significant public health issue in Nigeria, with approximately 128,000 new cases and 80,000 deaths annually. High mortality rates are often linked to late diagnosis and high treatment costs. Nigeria has made notable progress in tackling its cancer burden by establishing cancer centers such as the National Institute for Cancer Research and Treatment, NICRAT, to enhance diagnosis and treatment, among other initiatives. And steering NICRAT's efforts is Professor Usman Malami Aliyu, serving as its Director General.
Well, the current situation of cancer in Nigeria mirrors what actually is happening in the other part of the countries in the world. Though a lot of effort has been put, to curtail the rising incidence of cancers, in the world. Unfortunately, the incidence is rising, not only in the African continent or Nigeria as a country, but rather in all parts of the world. And this has been attributed to so many factors. The way we live with our one, the lifestyle, we are currently living in, the type of food we eat, the, virtually lack of exercise, that is actually rampant in the country, the use of chemicals that we have, climate change, and so many other things. So, all those have been tagged as virtually what I've mentioned as contributors to the rising incidence of cancer generally, globally. I think the most recent statistic showed reported there are about 20 million in the year 2022. It was, I think, the most recent Globacam report that we have, which is an agency of World Health Organization that give us an update or report on that concern. And in Nigeria, around 145, they are about, a rough estimate of what we are having, of what we had, in the year 2020. So the projection that I always want to quote by scientists showed that this incidence is going to continue to rise until the world do something to curtail the menace. Projection by Pekin, I always used to refer to that projection. It was a study that he conducted. Pekin is a renowned oncologist, that made that assumption that if nothing is done, like in the next 1 decade, thereabout, that what we are seeing, the incidence we are seeing now currently is going to double. And what is scary is that half of all occurrences are going to come from the low and middle income countries. And Nigeria is among the countries that are within the low and middle income countries. So, having said that, it was out of that the government of the day now decided to have an agency in the country for cancer control. And that was what led to the creation or the establishment of the National Institute for Cancer Research and Treatment in Nigeria.
Under Professor Usman Aliu's leadership, the National Institute for Cancer Research and Treatment, NICRAT, has hit several key milestones in Nigeria's cancer fight, such as launching a cancer research agenda, building capacity for healthcare workers to boost oncology expertise, and running awareness-raising campaigns, among other initiatives.
So, if you look at the activities that we have been doing now for the past 3 years now, there has been increase in cancer screening and cancer awareness activities in the 6 geopolitical region. The Institute conducted several screening programs, health education programs, either alone or in conjunction with other NGOs in the country like Medicaid, Cancer Foundation, PICOG, and so many others. There has been awareness, and that awareness has actually, the awareness campaign and the screening has also contributed to the increase in the number of cases that we are seeing. Sometimes people do have the disease, but because they don't know what it is, so they prefer to go, maybe because of the cultural or traditional belief, just visit prayer houses, or just one babalawo and so many other. And from there, you just either pray or give them something has to be taken. And then you will discourage them from going to the hospital until they died. Nobody will know that they have the disease. But if you are embarking on screening programs, like what NICRAT has been doing currently, the federal government has been doing, more cases will come up, and that will increase, the incidence or the statistics that we are recording, regarding cancer. So it's a double-edged sword. As you are conducting more screening, the incidence is going to rise.
The National Institute for Cancer Research and Treatment is conducting awareness campaigns in local languages to educate Nigerians about cancer risks, symptoms, and prevention, aiming to lower the nation's cancer burden.
So you see, most of the screening programs that have been conducted are being done maybe by NGOs within the urban, or if I like to say urban and suburban. Most of the screening programs are within the cities. It was out of that we decided to be conducting now several programs in the rural areas. And when you do in the rural areas, you see that the disease that have been overt, not very much common in a certain area, has now suddenly starts to pop up. So, ab initio, it's not that there is no disease in that environment, but it's because that there are no people looking for that type of cancer within that environment. But with the advent of these more screening programs that we are doing and more health awareness, people are more aware of the disease and they seek health intervention more often. They have that attitudinal change, to seek health intervention that will actually make the incidence to increase. So that is just one aspect of it. When you do that, when you embark on large screening exercise and health awareness programs, as we are doing, the incidence will rise. So you don't stop at there. So what you do next is to strengthen and empower the centers that you have in the country that treat that problem. So what the Institute did actually through the Federal Ministry of Health in the country is to increase the availability of the machineries that are required to treat this ailment. And of recent, I know you are very much aware that we have launched 3 new cancer centers within the country, and 3 are coming in the hopefully first quarter of next year. So each, in addition to what we already have, each region in the country is going to have 1, and that improve or increase access and the availability of cancer treatment centers to those that have the disease. So that is that in terms of equipment. The institute also currently selected 6 centers within the 6 geopolitical zones that we have in the country, and open what we call a screening center in each of the 6 regions in the country. The essence is to have centers closely within our people in each of the 6 geopolitical zones that people can walk in at any time and get themselves screened. It has never happened, in the history of this country. It is now that because most of the hospitals that you have, you cannot just walk into those hospitals and say that I want to get myself screened. There is no place where you can be referred to, but recently now we have those centers, and hopefully by the first quarter of next year, those centers are going to start functioning. All those will increase the detection, the early detection of that disease, and the importance of that. If you present early, if you are caught early, it means you can be cured. you can pick. There is that possibility of cure from the disease. So that is virtually that in the area of access. Yeah, yeah. It's just part of it. We also have what we call, it's also part of the access, what we call the Cancer Access Partnership Program that the Federal Ministry of Health and Social Welfare is doing under, in conjunction with NICRAT. Usually it's NICRAT that is championing that. The Cancer Access Program, it's an understanding MOU that with the National Institute for Cancer Research and Treatment enter, with the pharmaceutical companies that produce chemotherapeutic drugs, with the hope of reducing the cost of those medications. The government of the country will cut some waivers, give them some waivers for the import of the medication and some other parts. And in turn, they will give us those quality medication at like half the original price of those drugs. And you see, it is the federal government now that is subsidizing and improving the access of those medication to cancer patients. We also have what we call the Cancer Health Fund. Cancer Health Fund, it's a fund that is set aside for indigent cancer patients in the country, those that cannot afford. 6 centers currently, one situated in each of the geopolitical zones of the country, are running that program. If you have cancer and you've been assessed to be indigent, then you can have access for treatment through that fund. You can have access to that fund and you can receive your treatment free from those centers.
Research stands as a cornerstone in NICRAT's mission, and it is encouraging to see the Institute making notable strides in cancer research, particularly in enhancing patient care and outcomes.
So you see, research is something that is very key to solving the problems by Nigerians for Nigerians. Since the inception or the establishment of the institute, we've entered into collaborations with the universities, the teaching hospital within the country, the individual scientists, group of scientists on how to collaborate and improve, researches in the field of cancers. We also extended our hands of friendship to international institutions, universities, and hospitals, and even organizations outside the country. Currently, we are in collaboration with Mayo Clinic in the area of research. We have the American Association in Cancer Research. We are currently working with them in so many researches. We've even gotten some grants, in that the institute is working. Locally in the country here, the institute trained, there are about 10 institutions, 10 universities and 10 teaching hospitals, individuals coming from all this, from the 6 geopolitical zones. We train them in the area of clinical trials, on how to conduct what we call clinical trials, in the area of cancer. We've even given slots, admission for Nigerians to seek more knowledge up to master's level in cancer within the country. It's about the south and the northern part. Currently, the students are still running their program, and we've given like a grant of like 10 million per head to conduct research, new researches into cancer. Of recently, there were a team of scientists that discovered a plant in the country that has efficacy to treat brain, breast, and lung cancer. they were in Camred, Sokoto, Center for Advanced Medical Study. That was where they started the project. When they isolated, they took that sample to America. They screened it and found it to be very effective. So the Minister of for Health and Social Welfare now mandated the institute to work closely with them, and we are currently working with them to see how to support them, how to continue what they are doing to ensure that we produce these drugs and then share it to the market and even the populace of the country. So the institute has been doing a lot. There are so many things going out in the area of research. Although research is a long-term thing, but we are collaborating, and in the near future we hope to have our own standard lab, in the country that is purely meant for cancer research. We have our bio repository drugs where we can conduct with full confidence assay in the area of genomic assay, I think. We have what we call, there is this company that is what mentioned, Syndicate Bio and BioBina, that we are currently working in to map out the genomic sequences of all the cancers in the country, the common cancers. It has never happened. So if we do that, cancer has some genetic component. So if we do that, we'll be able to know this breast cancer in Nigeria, these are the drivers, from the gene of the cancer patient. These are the genes that are driving breast cancer in Nigeria. If it is cervical cancer, we will know. We are currently doing that. So once we know and we've gathered that image, then we can confidently produce drugs that can purely be targeted.
A national cancer registry is being launched to track incidents, prevalence, and trends, while global partnerships are being forged to strengthen research, clinical care, and training, all aimed at delivering timely, affordable cancer treatment across Nigeria.
Okay. So to actually improve access, you have to create more centers in the country, and that I've mentioned that within the span of this government, the 2 years of this government, we're able to increase those centers by 6. 3 are ready now. 3 are on their way, which I said hopefully in the first quarter they will come on board. That is from the government side, within 2 years of the government of His Excellency Bola Tinubu, GCFR. Currently, we have screening centers in 6 geopolitical zones in the tertiary hospitals that we have, which are going to become operational hopefully in the first week. And that is the effort of, NICRAD, the government, through NICRAD. It has never happened before, but we have centers now within the country, each of the geopolitical zone, that somebody can just walk in and get himself screened. That has never happened in the country. So you can see all this is an effort by the government to improve access, by providing those facilities that are needed for the treatment of that cancer patient. Government didn't stop there. They now went further to enter into this chemotherapy access partnership program to increase the supply of this chemotherapeutic agent at a subsidized rate to cancer patients. Otherwise, one chemotherapeutic drug can reach up to 5-10 million. But we are cutting the cost. So you can find them like 500, 200 and something at a subsidized rate. And it is the effort of the government. Now, government also went further to create what we call National Cancer Health Fund. And this Cancer Health Fund is for the indigent patient. It's meant to support those that doesn't have. There is what we also call Catastrophic Health Fund. It is a new innovation, insertion by the Federal Ministry of Health through the NHIA, which is going to come up any moment from now. That is meant for the treatment of cancer, hypertension, and diabetes. So government is trying its best, but know that Nigeria is actually a very large country with over 200 plus. So whatever you do will actually not be enough. So we also need the informal sector, to actually come invest in the area of cancer space. Although we are seeing more, we have you can see the NSIA Root is partnership through that. We have Marcel Root Hospital, and they are doing wonderfully well. So we encourage more private sector to come into play, so that at least we have more centers that can.
While cancer remains a major public health challenge in Nigeria, claiming many lives that could have been saved through timely awareness, screening, and treatment, Professor Usman Aliyu urged Nigerians to join hands in the fight against cancer.
Everybody should know that cancer is real, and early detection saves life. If you can take charge of your body, be health conscious. Whenever you feel something is wrong with your body, don't just go to prayer house or Babalawo. Please go to the nearest hospital and seek for help. From there, whatever it is, it can be cured instantly. If it is cancer, it's just a simple test that can be done, and it can be cured at that stage. So early presentation.
Cancer is not a death sentence. Early detection and treatment can save lives. Do not ignore symptoms. Let's work together to fight cancer. When it comes to cancer, prevention remains the most effective approach. The National Institute for Cancer Research and Treatment continues to champion this through community-centered initiatives, nationwide awareness campaigns, capacity building, and research collaboration. NICRAT is also developing a national cancer registry to monitor trends and identify gaps in cancer control. The institute is partnering with international organizations to strengthen cancer research, clinical care, and public health interventions in Nigeria. On treatment access, NICRAT has established the Cancer Health Fund to support indigent patients and is training health professionals to improve their capacity in cancer prevention and care. In addition, NICRAT's innovative cancer medicine demonstration project now provides free immunotherapy treatment to eligible Nigerian patients, a major step towards improving timely and affordable cancer treatment. Together, these efforts aim to bring quality cancer care closer to every Nigerian. Thank you for watching Health 247 on Rapid TV. I am Josephine Bitrus. See you next time.